So we're talking about knots in muscles. Now, knots occur if the muscles are used and they get tight. Sometimes you can get a build-up of fibrosis, which is a bit of scar tissue, and that's because the muscles have slight imperfections. Every time that they heal, it's like DNA. As we get older, the more times we renew the DNA, the more likelihood that the genetics of it will develop imperfections. Well, the muscles are the same. So when we're, for example, doing a bicep curl or we're outside sprinting, the muscles are being used and they will break down. It's called microtrauma. And if for some reason it decides that particular day when you've exercised, oh, I'm not going to heal up quite the way that I'm supposed to, it will develop a little bit of scar tissue and it will develop a little knot. And that's what massage therapists refer to, or other health professionals. The knots are what we have to break down. If you've got a knot, it can affect the muscle length, so it will shorten it. And the idea is to get rid of the knot as soon as possible, because the longer it's there, the more likelihood is that the muscle will stay in a shortened position. And if we can lengthen it, get rid of the scar tissue, the main thing is to go across the fibre to get rid of the fibrosis, and then to stretch the muscles, which you can do at home. And that's basically the idea behind how we can get rid of knots and why they develop. And there's other theories and there's other hypotheses, but it's kind of a little bit easier to understand. When we use muscles, we're breaking them down a little bit to heal back a bit stronger. Sometimes they develop imperfections, they cause knots, the knots spread out, they cause the muscles to tighten, the muscles shorten, and we need to break down the knots and lengthen the muscles to get them back and the joints working effectively.